Well, my friends, asthma or asthmatic troubles or dyspnea or respiratory distress, acute respiratory distress, respiratory problem, all are same, মোট কথা দম নিতে বা শ্বাস নিতে কষ্ট, দম নিতে বা শ্বাস নিতে কষ্ট। Nowadays আজকাল the asthma is also called COPD, chronic obstructive pulmonary diseases. This girl, aged about only 16 years, has been suffering from respiratory distress, শ্বাসকষ্ট, for last 1 year, এক বছর ধরে, has brought to me from the distant area of Midnapur district of Bengal. The main trouble is breathing problem, asthma, 1 year. A lot of investigations have done. What not? আমি যে বারবারই বলে থাকি, খাজনার থেকে বাজনা বেশি। So allopathic physicians have investigated a lot. Chest X-ray, pulmonary function test, and what not. And they have given these inhalers, given many injections. কটা ইঞ্জেকশন দিয়েছে? So is not improving. উন্নতি হচ্ছে না. He is not improved. 1 year, for the last 1 year, the girl is suffering from dyspnea, but there is no improvement. But the patient is now under my custody. She has come to me, but I have seen the case. I have taken the case and strongly I defined that the girl will be cured within 3 months, within 1 or 2 times medicine. The prescription is very easy to me because being a Hahnemannian homeopath, I always prefer, I do like to treat patients, to treat cases homeopathically. That means by case taking, by proper analysis and evaluation and interpretation of symptoms, with giving due respect to the causation, the medicine should be chosen. Asthma. The girl is suffering from asthma. We know the pathology of asthma. We know the pathophysiology of asthma. We have learned from the practice of medicine that asthmatic troubles, respiratory distress, or dyspnea is a chronic inflammatory disorder of the airways characterized by chronic airway inflammation and obstruction. Chronic inflammation is associated with airway hypersensitiveness that leads to recurrent episodes of wheezing respiration, ঘর ঘর, সাঁই সাঁই শব্দ, buzzing sound, wheezing sound, rattling sound, that leads to recurrent episodes of wheezing respiration. Difficult breathing, There is sensation of tightness. There is coughing. And all these due to reversible regioning of the airways. The restriction of the airway here is not permanent. The episodes are usually aggravated at night and in the early morning. In practice of medicine, the factors are given responsible for the asthma, bronchospasm, and congestion and thickening of lining of bronchial tree, and accumulation of mucus and phlegm in the smaller bronchi. In practice of medicine, it has been classified into bronchial asthma and cardiac asthma. Bronchial asthma is characterized by paroxysm of breathlessness with sensation of tightness of the chest and wheezing respiration, and with viscid bronchial mucoid secretions. The cardiac asthma, when mild exertion cause with severe breathlessness, that means respiratory difficulty on exertion, even slightest exertion, slightest ascending through stairs, and because it is due to heart failure, it is due to pulmonary congestion, it is due to pulmonary edema, and this is due to build-up of fluid in the lungs, which impairs the ability to supply the lungs. Now, apart from these two types of asthma, another kind of asthma is found which is known as allergic asthma. This asthma is caused by due to some allergens. Here the IgE, immunoglobulin E, is increased to encounter the allergens. Allergic rhinitis and all kinds of eczema over the skin are often present due to such allergens. And such allergens are maybe tobacco, maybe smoke, maybe household aerosol, paint fumes, pollens, house dirt, etc. So this is known and established in practice of medicine. সেই জন্যই, and that's why the allopathic physicians are treating this girl with allergic medicines in their own way. But homeopathic treatment is far beyond this pathology, is far beyond from this practice of medicine. It is a million distances from these therapeutic books. We believe man suffers due to various circumstantial factors, due to various causes. And among those causes, mental cause is very, very important. And to me, I have proved, I have shown the efficacious result of homeopathic medicines when administered, when given, with giving importance, with due importance to the mental causations. How this respiratory distress began in this girl? From scolding, from insulting, from humiliation from her father. বাবা বকা দিয়েছিল, রাত্রে বন্ধুদের সাথে ঠাকুর দেখতে বেরিয়েছিল গত বছর পূজায়, রাত্রে দেরি হয়ে গেছিল, কন্যা সন্তান 15 বছর বয়স, কোথায় গেল রাতে, রাগের চোটে তারা বকাবকি করেছিল, সবাই সমানভাবে নিতে পারে না। She insulted, she grieved, she mortified, and since then the respiratory distress began. বাবা বকেছিল, কষ্ট পেয়েছিল, অভিমান হয়েছিল, সেই চাপা রাগ, সেই চাপা দুঃখ তারপর থেকে ফুসফাস করতে করতেই তার আজকের এই অ্যালার্জি। Did the allopathic physicians look this side? Did they concentrate in this matter? No. It is not their headache. But we have. We have the idea. We have the knowledge of inner philosophy. We have the inner aspect of human psychology. So these ailments, grief after, mortification after. In my repertory, which is going to be published, see, alphabetical, dyspnea. Dyspnea, I have given mortification from only single medicine, pulsatilla. Dyspnea, mortification from pulsatilla. The book is going on, and other symptom corresponding pulsatilla, obesity, mild temperament, weeps easily, dry tongue, thirst less. So definitely the girl will be cured by pulsatilla. I do like to prescribe pulsatilla in 50 millisimal scale of potencies, and I do believe, boldly, strongly and confidently I may declare that the girl will be cured within one episode of pulsatilla, potentized medicine. Let's see the result, my friends. I shall share it.